Welcome to Something to Talk About from the Bainbridge Island Senior Community Center. As you see, today we're going to be talking about the Washington Cares Fund, WA Cares Fund, and Andrea Sanchez is with us. We're going to get to that in a minute, but I want to first acknowledge that we are meeting on the ancestral homeland of the Puget Sound Coast Salish people, specifically the Suquamish tribe here on Bainbridge Island, our neighbors to the north who have been living on the water of the Salish Sea since time immemorial. We honor them and we are learning from their stewardship of these lands and waters. And we're also grateful to Fieldstone Communities of Bainbridge Island, which is a sponsor of Something to Talk About. They offer independent and assisted living along with memory care up on Rolling Bay. To find out more, call them at 206-594-1010. And with that, I would like to welcome Andrea to talk to us a little bit about this program, which you have heard of, and that actually just got a new vote of support from voters in Washington State. The WA Cares plan, which is intended to provide long-term support for long-term care, I guess would be the best way to say that, right, Andrea?
Yeah, that sounds great. All right, thank
So
you, Wayne.
you're welcome.
We'll go ahead and get started.
You-
We typically like to start just talking a little bit about the need, why this program was developed, and then we'll give a little bit more information about the program's design. So we'll get started on the next slide. Family caregiving is really the bedrock of long-term care. According to AARP, about 11% of Washington residents are family caregivers. This is Sunny and Yenny, they're sisters and they're nurses who live in Seattle. And we have a little video about their family story. Go ahead and start that.
My mom was a nurse anesthetist in Korea, and we're both nurses, so it kind of runs in the family.
That was part of the reason why we were able to come here in 1974, because she had worked as a nurse and they wanted nurses to come, so she was able to bring the whole family.
Just a couple of years ago, we started noticing that my mom started to have some cognitive decline, kind of on the spectrum of dementia. Yenny and I have had to kind of put our jobs on the back burner to really help take care of my mom.
Some days were good, some days were very difficult. I mean, it's our mom, and there's nothing I wouldn't do for her to make sure she stays as independent as possible with the support that we can give her.
If we had a resource like WA Cares, that would have been so helpful to just kind of ease some of our financial burden in trying to do this. It's very difficult. So we try to simplify her life. We do her grocery shopping, and she often will come with us, and cooking, cleaning, cutting her hair, taking her out socially, but we're creating meals that she is familiar with and that she enjoys. And we like to bring her out to do fun things too, and not just like all medical all the time. Believe me, it will affect you, whether you're younger or older, to have a resource like that and to know that the state is investing in families. That means a lot to me. WA Cares is a program that I think will benefit everybody.
So one of the key takeaways from the story of Sunny and Yenny is that it's not just people with lower incomes who are overwhelmed by long-term care challenges. It impacts the majority of people. People who are middle class, even upper middle class families are impacted as well. 7 in 10 of us are going to need long-term care at some point in our lives. Maybe we need help with meal prep, eating, bathing, dressing, staying safe, getting around without falling. The problem is that long-term care can be expensive, and it's almost $36,000 a year for 20 hours of home care per week, which is the average that's needed by current Medicaid long-term care clients. Because long-term care isn't medical care, it's not covered by health insurance or Medicare, except for in rare circumstances. And it's only covered by Medicaid after you've spent down your life savings, typically down to just $2,000. Even though long-term care is a predictable cost, most of us don't have a way to pay for it. Looking at the median household income for Washington seniors here, it's $56,000 per year. 41% of workers that are nearing retirement have no projected retirement income from a pension, a 401k, or an IRA. And another 42% have no pension and only enough 401k or IRA savings to replace 10% of their pre-retirement income. So again, it's not just low-income families who can't afford long-term care. It's typically between 80 to 90% of our population. This is especially critical because our population is continuing to age rapidly. The population of Washingtonians that are 85 and older will quadruple from 2025 to 2050. And not only will there be more older adults in the coming decades, the population that is typically doing the caregiving will stagnate. On the next slide, we have the caregiver support ratio, which is the number of potential family caregivers ages 45 to 64 for everyone that's 80 years old and older. That's declining sharply. That means that a
I
lot
can
less-
imagine. My dad recently passed at the age of 97. He had 4 kids. I have 2, and some people have 1 or none.
Absolutely, absolutely. So a lot less family support's going to be available when we're in those high-risk years of needing care. And family caregivers are much more likely to be providing care for multiple loved ones at a time. So as a society, we need to figure out a way to provide support for those caregivers and find ways, new ways to help families with their long-term care needs. While walk cares might seem like a new expense for workers, it's important to just keep in mind the current system of relying on unpaid family caregivers to provide the vast majority of care isn't actually free for those families. Almost half of family caregivers have a related financial setback. Many are spending on average 25% of their own income on care-related expenses. And it's really common for caregivers to leave the workforce early so that they can provide care. Caregivers who are 50 and older who do this lose an average of more than $300,000 in wages and benefits.
The ladies that were in the video are an example of that, where they said they kind of had to put their lives on hold to help take care of their mom.
Exactly. So with some of these challenges in mind and facing a projected doubling of Medicaid long-term care costs by 2040, the Washington State Joint Legislative Executive Committee on Aging and Disability began looking at options in 2014 for a public policy innovation that would address some of these challenges. They were looking to preserve the Medicaid program budget, offer affordable long-term care insurance coverage, provide some financial relief to middle-class families and their caregivers, and be financially viable and sustainable in the long run. The Joint Legislative Executive Committee spent several years working with stakeholders and policy experts and actuaries to look at both private and public solutions. And after extensive research on those approaches, they found that a program like WACARES, which is someone that covers everyone, similar to Social Security or Medicare, is really the only way to provide affordable coverage for all. Over time, the legislature improved the program in a few different ways. For example, they added a pathway for near retirees to earn benefits, which we'll talk a little bit about later. And they also created a way for people to take the benefits with them when they leave the state. So I'll talk a little bit about how the program works next. WACARES is an earned benefit, so that means that you contribute for a certain number of years to qualify for benefits. It's a program that's entirely self-funded from workers' contributions. Those contributions all go into a dedicated trust fund that can only be used for WACARES. Workers contribute 0.58% of every paycheck to WACARES. The median covered worker makes just over $50,000 and would contribute $291 a year or $24 a month. People only contribute while they're working, so contributions will stop when you retire or if you become unemployed or if you're caring, for a loved one and you're not working. It's a community rated program, so everyone's covered at that same rate, regardless of any pre-existing conditions. And contributions to the program began in July of 2023, with benefits becoming available July of 2026. Our next slide just shows what contributions might look like over the course of a career based on someone's annual salary. That typical worker's income is just about the level in green, $50,000. You can see that each year that person would pay about $290 each year, totaling out for $8,700 over the course of their career. And that's going to fund a benefit amount that starts at $36,500 and it grows with inflation over time. So looking at qualifying for benefits, everybody who's contributing to Walk Cares more than 500 hours per year is earning benefits. So part-time and temporary workers are included. By contributing for a certain number of years, a worker earns access to their benefit. And there are 3 different pathways to meeting those contribution requirements. The first one is lifetime access. This is the pathway that we expect the majority of Washingtonians to use. To use this pathway, workers will contribute for 10 years without a break of 5 or more consecutive years. This pathway earns them access to the full benefit amount. Again, that's $36,500. The next path in the middle is early access. So this one is for workers who haven't yet earned their lifetime benefit, but they have a care need while they're working or soon after leaving work. To qualify, they need to have contributed for at least 3 years out of the last 6 at the time that they apply. This pathway earns them access to that full benefit amount, the $36,500. And then finally, we have a special pathway for people who are nearing retirement. People who were born before 1968 and they're nearing retirement as the program began and unlikely to qualify for that 10-year pathway, they can earn 10% of the full benefit amount for each year that they work. So for example, if they work and contribute for 500 hours per year for 3 years, they'd earn 30% of the benefit amount, or just under $11,000. Those near retirees will have permanent access to whatever percentage of the benefit amount they earn at any time that they need care. And they could also qualify through one of the other pathways if they met that requirement. Once the worker meets the contribution requirements and they need help with at least 3 activities of daily living, then they can access their Walk Cares benefits. With this program, workers have the flexibility to choose the services and supports that meet their needs. They could choose an in-home caregiver, a residential care. They could make modifications to their home. They could use assistive technology like medication reminders or fall detection. And Walk Cares is really designed to help people age in place in their homes for as long as possible. For the most part, that's what most of us want to do if we can, and if we have the right supports in place, we're usually able to do that. Walk Cares has many options to provide support for family caregivers. So people could choose a spouse or family member to care for them and have them be paid for that care. This can help lessen the burden on family caregivers by paying for their time or making sure that they can get other wraparound support services like respite, meals, and other things for that family member. We get asked a lot about how far the benefit will go. It doesn't cover 100% of care for everyone, but it would cover the amount of in-home care that the average Medicaid client uses for roughly a year. About 1/3 of people need care for a year or less, and for those people, Walk Cares may be able to cover all the care they need. For others, Walk Cares provides the family with immediate relief and some time to plan for future costs. These show 3 different examples of how someone might use their benefit. So someone could pay a family member to care for them for about 10 hours a week for 2 years. They could get care supplies for a total of about $33,500. Or they could choose services to help them stay safely in their home by purchasing a home a home modification, and a wheelchair ramp. They could get an electric wheelchair or a scooter, and they could have meals delivered for around 3 years for $26,800. Or somebody who needs long-term care because they have an unexpected injury could get 20 hours of in-home care per week for a year, plus transportation to appointments and crutches for about $34,600. So earlier this year, the legislature passed a new law that allows people to take their Walk Cares benefit with them if they move out of state. So under this new law, starting in July of 2026, Washington workers can choose to continue participating in Walk Cares if they move out of state. To become an out-of-state participant, workers have to contribute to Walk Cares for at least 3 years, in which they've worked at least 500 hours per year. And then they need to opt in within a year of leaving Washington. Just like other workers that are in state, out-of-state participants will keep contributing to the fund just during their working years. And the state will create a process for those out-of-state participants to report their earnings and pay premiums, with a focus on making it easy for participants to do that. For people who live out of state where they need care, benefits will become available starting in July of 2030. So we have a little longer of a runway to figure out how to deliver benefits across the rest of the nation. So those are all the prepared slides that we have today. Does anyone have any questions or comments?
I would just note that I was wondering that the 36,000 is what you said was about a year for somebody getting services on Medicaid. Did that figure in at all in trying to figure out what was possible in terms of delivery as we're launching this program in this state?
Yeah, so are you kind of asking how the amount came to be?
How the 36,500, what that's what kind of
Yeah.
made that, because obviously those of us who are familiar with long-term care recognize that, yeah, the costs are extreme and what you're doing is definitely helping. It's not going to solve the problem, but
Yeah, exactly. Yeah, that was a component. They when the legislature passed it, they wanted to figure out a way to balance affordable premiums with a meaningful benefit. So, if they wanted the benefit to be higher, they could do that. But the actuarial analysis showed that if they wanted a premium as low as, the 0.58% of wages, then they really needed to make sure that benefit was modest. I think that the 36.5, they did look at Medicaid data to say, okay, how much does that get somebody, trying to focus on being able to keep people in their homes rather than, residential settings, and trying to catch people a little bit earlier in their journey than the time that they need maybe to, live in a facility-based setting.
And then my other question is, you mentioned that you need to meet or not be able to accomplish regularly 3 of the activities of daily living. And is that something that is determined by your physician?
It will be determined by DSHS. We are actually going to be doing the assessments, and we're defining those activities of daily living in our agency rules. So there are things like eating, bathing, medication management, using the bathroom. There's 7 of them. So DSHS will do that assessment, and for most folks, we will do those in the home.
Okay. Maridel or Sheila, did you have a question?
I do. This is kind of a strange one, but I've been retired since 2001, and at age 85, I got a job. It's just part-time, and I thought I also have a fully funded, fully vested long-term care policy that I purchased about 30 years ago and have been keeping up each year, paying a significant amount to keep it up, but it's a very good policy. But it kind of bugs me that I have to pay into this one now. I called the organization that's running this, some part of DSHS, I think it was, and asked how I can opt out. And they said I had to opt out by December of a year ago. Well, or 2 years ago now, but I hadn't even thought I would ever have another job. So I didn't opt out. Why does my money just go into a pot that will help other people? It does sort of bug me that I have to pay into it.
Yeah, yeah, I can understand that. I know. It does go into the Walk Cares Fund, and if you are working at least 500 hours in a year, you will earn a tenth of that benefit amount for every year that you work. So you could use it to supplement your private policy. One of the things that and it depends on your policy, but some of the private policies have a waiting period where you have to pay out of pocket. And Walk Cares could come in and pay some of those initial years or initial dollars that your plan might require. So if you are working the 500 hours a year, each year that you're working that, you would be earning 10% of that 36.5 that you could use when you need care.
But the minimum amount of years you have to do that is 5.
No, you can, if you were born before 1968, then you're earning 1/10 every single year. So there's no longevity requirement. It's just each calendar year that you work 500 hours, you're getting the $3,650 toward your Walk Cares
Mhm.
benefit.
Which has its benefits, I guess, eh?
Yeah.
Okay, so it's not totally lost then
Yeah.
if I'm the key is the 500 hours per year.
Yes, that's right.
Okay, thank you. I think it's a good program. I wish it had happened a lot earlier
Absolutely.
for more of my colleagues at my age, but I'm glad that it exists. And it did just kind of annoy me that there was no opt out, except if you had some premonition that you might someday get another job when you're in your 80s and 90s.
Yeah, yeah, I think it is a challenge, we're the first state in the nation to do this. And, in the beginning, it was, it's got to be kind of everybody's in, right? Or else you can't afford the program over the long term. So the legislature did make little tweaks and changes, and they did have a short-term opt-out for folks. But now that we're kind of in, there are a few small exemptions, but for the most part, the
Well, I
idea
think
is that
that
everybody's working is paying in. Yeah.
Yeah.
No, the other thing that was a concern was the idea of portability, that if I were to leave the state after I had put a significant amount of money into the program, was I just going to lose that? And it looks like, thanks to the legislature, that's going to get worked out as well, which makes it, as a earned benefit, make a lot more sense. I'm wondering about the middle. I don't know if we can go back to this slide, but you had 3 slides. One which was sort of spoke to Meridell's case of early, soon-to-be retirees who were born in a certain period, and then there was an earlier, the full benefit, and then the one in the middle, which was early access. Can you explain that a little bit better? What the distinction is there?
Sure. Yeah, I think that one is a little hard to describe, but we can try to give an example. So um, let's say I worked 500 hours a year starting in 2023 when they started taking the benefits out. And I worked in 23, 24, and 25, and then I stopped working for the rest of my life. I would have 3 more years to apply. And if I did and I needed long-term care, I would get that full benefit because I have 3 years earned from the day that I apply for benefits. But if I waited, let's say 10 years later, I came in and I applied, those 3 years wouldn't fall into the look back period. So I would not receive those benefits. And if I wasn't born before 1968, then I wouldn't have access to the Walk Cares benefit. So it's really intended for people who are, hurt or injured or have a, heart attack or a stroke or an incident, something earlier in their careers or while they're working so that they can get that full benefit. And it's for the people who maybe didn't get all the way through the 10 years to earn their kind of permanent coverage.
Yeah, that explains it to me. Does that make sense to you too, Meridell?
Well, now I'm looking at this right-hand column for near retirees. That still requires the 500 hours per year.
Yes.
Okay. Yeah, I don't think I qualify because I only work 1 day a week.
Okay. Yeah, if it had one long day.
Yeah, you need to work a 10-hour day, Meridell, which I know you're certainly capable of.
I'm capable of it, but between my commute and everything, it's at least 10 hours a day, but that's not how many hours I'm getting paid for working. Yeah, okay.
Thank you. I think those are the questions I have. Sheila, anything?
Find this fascinating. Thank you so much for all this information. I need to pass this on to my daughter and let her know about it. I'm not planning. I mean, I'm still working part-time. That makes a difference, right? Part-time. Well, Meridell's part-time.
If you work, you have to work 10 hours, right? 10 hours a week.
Yeah. Well, I definitely do that when I go
Great.
to Mariners. Yes.
Right. The Mariners are grateful for
hours.
your service.
Yes, indeed. So, but this is wonderful because I was concerned about what would happen should something, God forbid, happen to me. My kids have told me, you're coming and living with us no matter what. And I thought that was nice. I appreciate that. And but they would then be involved in this program.
Great.
That's
They
great,
could be
yes.
very, very useful. So if I want to learn more, remind me or tell us what to do to the website that's involved, or if we have questions.
Yeah, that would be good.
Yeah, on the next, there we go. Sorry, I don't know if you can hear my dog barking. It's very distracting to me.
All right.
This is our website, and then we have phone number, email, and ways to follow us on social media. And we do have one more slide. I think we're trying out this little QR code where we're asking for people to do a survey. So if you have the ability to scan a QR code and tell us how we did today, that would be fantastic.
Let's leave that up on the screen for just another minute in case somebody who's watching it later wants to point their camera at the screen.
All right. Well,
And-
thank you so much for hosting. Yeah, we appreciate you having us on.
Yes, as Sheila said, very informative. We appreciate you walking us through this, and it's a program that's brand new, and so we're all asking questions about how it's going to work for us, and people who are starting to pay into that are going to want to have some assurance of how it's going to work for them as well.